Peter Hoskinson, student number 11664085, assessment 2, EHR 331, exercise, health and disease. My client is a generally healthy 51-year-old woman who walks at least 5 times a week. I've informed the client of the process of information collection, testing and program planning. She understood and provided verbal consent to doing the assessment and the training. She has no history of disease, including cardiovascular, pulmonary or diabetes. Her BMI is in a good range which matches her physical appearance and condition. The client advises of knee pain after 2 to 3 hours of walking, which is stopping her achieving her goal of long walks of 5 hours or longer. I've discussed the APSS form with the client. We went through the stage 2 questions together. She understood the significance of the data collected, and based on the information collected, she is healthy with no underlying issues. She has no family history of diseases such as cardiovascular, pulmonary or diabetes. Discussed with the client the ongoing musculoskeletal injury she referred to in stage 2 of the APSS form. The client reported that this had been raised with her GP and there was no diagnosed issues such as trauma, strains or tears. The client indicated that the pain worsens with exercise. However, the GP had cleared her of any injury and cleared her to continue to do her walking exercise. We reviewed the client's current physical activity, which is primarily based on light walks. However, given the time she completes, she does meet the physical activity guidelines. She currently isn't doing any resistance training, and that is one of our key points in our SMART goals that we went through. We went through the SMART goals looking at each component. Specifically, we're looking at strengthening leg muscles to reduce the pain on long walks. Our measurable feature is that not only will the client be able to refer her pain levels, we also do range of motion testing. Achievable, this should be achievable within our 12-week time frame. It's realistic if the client does the exercises and stays free. And timely, we shall review it for 6 weeks and expect changes at 12 weeks. Our exercise prescription is primarily to address glutes, hips, hamstrings and quads. So it's largely leg-based exercises. These exercises will set a benchmark and also assist in identifying if there's weak side or weak muscles. Initially, we'll set the exercises what we believe is a very achievable level so the client learns good technique and feels like she's achieving so that we can ensure compliance. From this benchmark, we'll increase the frequency and number of the exercises as we go. Our exercise plan is to commence the exercises into a easily achievable daily routine. If there's any soreness, we'll recommend do every second day. We'll reassess after the first week to see how she's going, and we may adjust the number of each exercises or modify the exercises if they're too easy or too hard. We'll do the exercises for 4 weeks and then do a reassessment and look at increasing frequency and type of exercise. The client's goal is very simple in that she wants to complete bushwalks of over 5 hours without the disabling knee pain she's currently getting. She's been cleared of the doctor of any musculoskeletal injuries such as torn ligaments in her knees. So our primary exercise prescription is adding resistance training to her existing walking to meet both the physical activity recommendations and her personal goals. The resistance training exercises we have set for the client in conjunction with her walking should improve her core strength and balance. The client enjoys doing her shorter daily walks on nature trails, which may have emotional and physical benefits. She does her longer walks in the peace and quiet of remote mountain trails. For women of the client's age, walking is an ideal form of exercise to reduce the risk of cardiovascular events as well as improve bone mineral density. One addition we may add to the client is suggesting she walks with Nordic poles to give her additional support and assist with her posture. It is important to challenge the client by increasing the frequency and intensity of the exercises. Frequency is increased from once a week in week 1 to 2 times a week in weeks 2 to 4, and then based on reassessment will be increased to 3 times per week for weeks 5 to 12. The intensity of the exercise increased by simply increasing the number of reps from 10 to 20. The type of the exercise can also be modified as the client gets stronger and more proficient. For example, dumbbells may be added to the squats and the weights increased every 2 weeks. Testing pre and post exercise is important to give a quantitative measure of improvement achieved by the exercise prescription. Hence, we've done a range of motion and strength tests prior to the commencement of the program to use as benchmarks. I've deliberately kept the test very simple to not overwhelm the client, as this is a new type of exercise routine to her. The tests were repeated at 6 weeks and 12 weeks to see improvements. Significant improvement was seen in the range of motion at both ankle and knee. The client also improved her core strength significantly and doubled her squat weight from 20 kilos to 40 kilos. Overall, there's been improvement in leg, back, and core strength. This improvement is reflected in improvement in the client's posture, balance, and body resilience. Behavioural change is very important in leading to improvement in people's physical and mental health. Mental health changes due to exercise can lead to improvements in self-esteem and confidence. Promotion of self-belief is paramount to achieving behavioural change. I have tried to achieve behavioural change by providing the client with suitable environment to exercise. Behavioural change can be achieved by having the correct personal, behavioural and environmental factors as per social cognitive theory. The physical activity guidelines are developed by the Australian Government for people of all ages. Our client easily meets the guidelines of 2.5 to 5 hours of moderate intensity activity such as a brisk walk. However, a lot of her walking may be considered low physical activity, so one of the changes we'll make to her current activity is looking at increasing that level of intensity, and we'll do that just by her own rate of perceived exertion, just that she can rate that she's working harder than she has before, sort of thing. In addition to that, we'll have the 2 to 3 days of resistance training for 30 minutes, and that will combine with her walking time to exceed the physical activity guidelines. And also, in addition to that, the client does household tasks that involve lifting, carrying, and digging, and these could be considered part of the physical activity time as well. From discussion with the client's primary concern is the pain in the right knee on long trail walks. This commonly occurs after 2 to 3 hours walking, so it makes it difficult to replicate in a training situation. The client has had incidents where she required assistance after she'd been walking for 3 hours. Our training objective is to get the client doing the prescribed exercises to build up her strength and give her the confidence to complete her bushwalks. The exercises will be increased in frequency, intensity, and the type of exercise as she adapts to the current level she's working at. Walking is a form of exercise which has positive effects on decreasing health risks and increasing disease prevention. Walking is one of the factors which reduces risks of cardiovascular events in postmenopausal women. Walking has also been shown to increase bone mineral density. One of the possible causes of knee pain in our client is osteoarthritis. This is caused by a loss of estrogen in postmenopausal women. So the walking and the resistance exercises may benefit in this area. The walking and the resistance exercises combined will also improve the chances of fall prevention, which is very important for our client being in a environment with a rough surface walking on or walking on uneven surfaces. The client and I discussed the benefits of walking in nature, and she said she felt much better when she's regularly walking in the bush. She misses being able to complete her long bushwalks, some of which are overnight, and this can get her down. So she's looking forward to having the strength to be confident to complete these walks. In summary, we've provided a specific exercise intervention based around resistance training to meet the needs of our 51-year-old female client with knee pain. The resistance training was based on her goals of enjoying long bushwalks as well as meeting the physical activity guidelines. The additional benefit is having our client walking in nature will both increase disease prevention and her mental health well-being. The reference list on the next two slides has been researched from various scholarly sources.